Which beta blocker pre-transplant were you on?
Metoprolol.
My name is Heather Ross, and I am the Director of the Heart Transplant Program and the Director of the Ted Rogers Center of Excellence in Heart Function. Hey, Corey.
Hello, how are you?
Good, how you doing?
Good.
I look after patients who have advanced heart failure and manage those patients and make decisions about transplant or mechanical hearts. And in addition, I educate fellows and trainees from all over the world.
Right, and actually changing the journey from patient to recipient, because you're going from sickness to wellness.
Patients are the inspiration. There is no question when you meet somebody and you can make a positive impact. You see the change, and when somebody goes on to have a child or walk their daughter down the aisle or graduate from university, those are the reasons that we do what we do, is to make that difference. Every day you want to do it better. There's a number of things that I worry about when I do these trips, and first and foremost, I worry about Dale. The risk level on the trips is not insignificant, so it's a very different thing to think about putting that patient in a position that might be risk. The phrase "shit happens" comes about for a reason, and no matter how well prepared you are, the unexpected can happen. In 2006, when we went to the Antarctic, we came within 200 vertical meters of the summit, so just incredibly close, so close you could taste it. And unfortunately, we had to turn back because of safety reasons. And we got back to camp at about 6, 7 o'clock at night. Tried to eat dinner, unable to, a lot of vomiting, I couldn't keep anything down. Hit the sack at 9 and I couldn't sleep because of my breathing. I got progressively sicker and went into high altitude pulmonary edema. And my oxygen saturations dropped into the 40s. That's a climber emergency. High altitude pulmonary edema is very similar to what patients with heart failure feel. Your lungs essentially fill up with fluid. So essentially you're drowning in your own fluids. When the climber emergency was declared at 3 in the morning, it was clear that the most important thing was to get me down the mountain. I wasn't in a position to carry any of my gear. My oxygen levels were still dangerously low. And Dale carried my necessary gear with a tight rope because I was very unsteady on my feet. It helped me walk down the mountain. I'm not sure I've actually fully come to terms with much of it. It's a little hard to almost die and not necessarily fully appreciate that you're almost dying because your oxygen levels are so low. It was remarkable to look in Dale's eyes as he was helping to save my life and see that feeling of I'm repaying what has been given to me. And I'm still, as you can probably tell, still having issues when I try to talk about it. It's very uncomfortable. It's a very uncomfortable thing. I don't think there's any question that that trip gave me insight into what patients go through. And I think when you've actually experienced, even in some small way, what they're going through, I think it does make you more compassionate to their plight.